members of the Spinal Cord Society that we have been able to get this meeting to Chennai. So there's a lot of reasons why this has come to Chennai. One is, see, Tamil Nadu, if you all don't know, is probably the number one on road accidents. So we do have a very serious problem. So we are a healthcare capital. You know, Tamil Nadu's Chennai especially is an healthcare hub, and we are very good at treating acute care. But when it comes to rehabilitation, we do not have the kind of facilities that Delhi or any other major cities does have. So it's very important that people in Chennai and south of India, they understand the importance of rehabilitation, importance of managing this very complex problem. So spinal cord injury is not like any other small other injury where you get fixed with it and then you get on with life. This is a lifelong disease. So managing this needs a lot of expertise. So this conference hopefully is focusing on bringing all the experts. So the people who are attending this conference are not just doctors. It is paramedical staff, nurses, physiotherapists, occupational therapists, psychologists, consumers, patients themselves are here. They are here to share their experience. And so we are finding a common ground about what is best and what is the best way to treat with these people, because it varies from different parts of the country. So that is the reason why we have this conference. So there is a very important social message here as well, and that is why we are all here. And hopefully you will go through the program and you will see that, you know, it's a huge area to cover. So now I welcome Dr. Chabra to say a few words about this as well.
This mic is not working.
Yeah, I think that. So we have that mic.
I'll have Dr. Mukherjee address you first.
My name is Dr. Mukherjee.
All to this very important event here. I must start by complimenting the organizers, the Kaveri Hospital, and their representatives here for this very noble initiative. You have heard about spinal cord injury and how devastating it can be. In fact, it is described as the most devastating ailment that human being can be afflicted with. And perhaps many of you may not know that it was described as an ailment not to be treated, not till very long ago. It was only in the Second World War that they showed that if properly treated, these people can lead a near normal lifestyle. Just to give you the statistics, during the First World War, during the war there are a lot of casualties, so similarly there are a lot of spinal cord injuries also which take place. So during the First World War, only 1% of people who got spinal injured survived more than 1 year. All of the remaining succumbed within 1 year of the injury. So during the Second World War, when they came up with this concept that these people can be managed properly, Sir Ludwig Guttmann was the father figure of spinal injury. So then a number of spinal injury centers mushroomed across the globe. But this took place mainly in the developed countries. So in emerging countries like India, it took a backseat because you have far bigger problems in infectious diseases, etc. So spinal injury was not taken into consideration. And you cannot demonstrate as good results as you could do with a fracture fixation or other things. Even though some services, Dr. Bala told you that Tamil Nadu lacks with such services, but it's not only Tamil Nadu. You can count on your fingers the number of centers which are available in the country to manage spinal injury. So imagine the vast population, right? And having facilities far less than a much smaller country to be able to manage such cases. So there needs to be plenty of infrastructure in the country to manage this most devastating ailment that afflict mankind. And again, I must compliment Kaveri Hospital for taking the initiative to consider starting similar services. I believe spinal injury services will be established at Kaveri Hospital soon, and I must compliment them for this initiative.
Hospital, and it's my first visit to Chennai, and I'm delighted to be here. But as Dr. Chabra mentioned, I've worked now about 25 years in Asia, coming initially to Bangladesh, for 2 years. But in that time, what I have witnessed is that high levels of injuries, disabilities and spinal injury across the region. As Dr. Chabra mentioned, it used to be a condition that was not to be treated because of the complexity of the injury. But what I have found that when appropriate rehabilitation is provided, it is very treatable. And people, you can see people around this conference moving around in wheelchairs. It's very possible to have a life after spinal injury. And I feel that this is why this meeting is so important. I think it's one is the educational aspect. I represent the International Spinal Cord Society Educational Committee, so it's very important to increase the capacity of healthcare staff in the management of this condition. It's also very important to make people realise that this is a speciality and to encourage young doctors and professionals to go into this area of rehabilitation. And I feel another very important reason for this meeting is that actually, as Dr. Chabra mentioned, is actually to encourage and stimulate the development of services, because the people you see around this conference in wheelchairs would not be here. They would not have survived if they didn't have the services they need. So I think having this conference, it promotes that. And I feel the third and most important thing is why you are all here, to actually increase awareness about spinal injury in Chennai and in Tamil Nadu and in India, because it's a condition that we were talking about. You don't realise its impact until it affects you or it affects your family, but it can have a devastating effect, but it is possible to manage. So I think to increase awareness of, to prevent the condition in the first instance, but also to increase awareness that this is a condition that can be managed and people can have a life after injury.